Bismillahirrahmanirrahim. We are talking about the type of tremor. First number is the essential tremor. The essential tremor. The essential tremor is the most common movement disorder. It is the most common movement disorder. The essential tremor is the most common movement disorder. It affects the 5% of population. It affects the 5% of population. The essential tremor may be present with childhood. Its incidence increases as the age increases, and peak is 70 years. At the age of 70 years, the essential tremor may become worse. Essential tremor is the high frequency tremor, that is 6 to 11 hertz of frequency tremor, that is essential tremor. The essential tremor mostly affects the upper extremity. It mostly affects the upper extremity. It affects the upper extremity mostly. The essential tremor is mainly the action tremor or postural tremor. They are mainly the action tremor or postural tremor. What is the action tremor and postural tremor? The action tremor is the tremor that started when the person start in action. Postural tremor is the tremor when the person began to adopt a posture, that is postural tremor. The essential tremor, there is normal neurological examination. Normal neurological examination. Normal neurological examinations in the case of the essential tremor. The essential tremor may be improved by alcohol. Improved by alcohol and worsen by stress. Stress can worsen the essential tremor, and alcohol can reduce the essential tremor. In severe cases, the essential tremor can affect the eating and drinking capacity. Eating and drinking capacity of a patient. The essential tremor are typically bilateral. Typically, the essential tremor are bilateral, but may be unilateral in some cases. The essential tremor involve in head region 30%, tongue 20% of cases they involve the tongue, voice 20% of the cases they affects the voice of a patient, and jaw and face. Jaw and face may be involved and affected in 10% of the cases of the essential tremor. The lower lip may be involved. The lower limb may be involved in 10% of the cases. The head is involved in the essential tremor, 30% of cases, tongue 20% of the cases, voice 20% of the cases, face 10% of the cases. This is the multi-parts tremor. Multi-parts tremor. The multi-parts tremor. In the multi-part tremor of the essential tremor, that is multi-part tremor occur in 50% of the essential tremor. This is the multi-parts are involved. Now we will discuss the physiology of the essential tremor. About 50% of the cases of the essential tremor are familial. 50% cases have positive family history. The mode of inheritance is autosomal dominant. Autosomal dominant. In this autosomal dominant disease of the that is essential tremor, in 50% of the cases, that is the autosomal dominant. The cerebellum and inferior olivary nucleus have been involved as a possible sites. Inferior olivary and cerebellum. Cerebellum are involved and inferior olivary nucleus are involved. In this cerebellum and inferior olivary nucleus, in this case of the tremor, they act as a pacemaker for tremor. Pacemaker for tremor. And this initiate the tremor. Other disease may cause the essential tremor. Example, metabolic disease or syndrome, blood flow problem, some cerebral pathology. There is loss of Purkinje cell in the cerebral pathology. This is loss of Purkinje cells. Loss of Purkinje cell can also cause the essential tremor. Now we will discuss the treatment for the essential tremor. Generally, we need no need of treatment in general cases, but in severe cases, we give the beta blocker. Example, propranolol 20 to 120 mg per day. We can also give primidone. We can also give primidone. The starting dose of primidone is 12.5 mg. We start at this dose, then we will increase 125 mg to 250 mg in severe cases in which there is dysphagia, that is, and adenophagia. We can give beta blocker and primidone. The beta blocker, a primidone, we can give. We can also give the gabapentin, topiramate. We can also give the topiramate and the gabapentin. The best treatment is the surgery in very severe cases of the essential tremor. Surgery name is intermediate nucleus of thalamus. Intermediate nucleus of thalamus. This is very effective, very effective. Now we discuss the treatment of the essential tremor. Generally no need of treatment in cases of the mild cases of the essential tremor. In severe cases, we give beta blocker. Example, propranolol 20 to 120 mg per day. Primidone, starting dose is 12.5 mg. Then we will increase slowly. That is 125 mg to 250 mg per day. Gabapentin, we can also give gabapentin, topiramate, which is anti-seizure drug. We can give topiramate also. The surgery need the surgery. We can operate by the intermediate nucleus of the thalamus. This is a very effective treatment in which all other medical treatment fail. In this case, we will give the intermediate nucleus of the thalamus. This is the type of surgery for essential tremor.